Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide good general medical information. It's not meant to provide specific medical advice. Please do see your primary care physician or provider to obtain medical advice that's tailored specifically for your needs. At the end of this video, I will provide some spiritual information. If you do not want to stay for that portion of the video, once the medical information portion is finished, I will let you know. And at that point, you can click away. But first, please do like and subscribe. So today's topic is going to be about new medications. I have touched on these medications in previous videos. This video is going to focus on the same information, but from the perspective of talking about the medications themselves. I have done 2 prior videos that speak about medications directly as well, and I encourage you to go to my channel and review those videos, please. Okay, so I am going to share my screen. I did make a PowerPoint slideshow for you. And if any of you guys know, that's something nice that I can do. I'm improving as time goes on. But I will say that I do still recommend using my channel as more of a podcast. Okay, so let me get the screen that really matters for you. I'll have to go with this one. Okay, so you guys can see this screen, and I'm going to go to the very top. And this is the first slide I prepared for you. So I call it new medicines because these medicines, although widely used and have been used for some time, are relatively new. And there's a learning curve. I think that there's a learning opportunity for patients. So going over these medications again in this different angle or different point of view will be helpful for some people. And that is my name there, Laura Tigler. So today we're going to talk about these new medications in 5 different ways. I'm going to give you the recommendations that we doctors give patients. It's important that you're familiar with that. And as I've said in other videos, I want you to read, and read, question, and question, and use your doctor or provider as a partner. And you should be up to speed and trying to educate yourself. We're also going to talk about what is considered the best drug of overall. I'm going to give you a summary of the new drugs, and I'll give you a summary of these medications from different angles. And we're going to talk about cardiovascular outcome trials, but not just trials that focus on cardiovascular events, such as myocardial infarction, which we've talked about in a prior video, but also talking about heart failure, talking about chronic kidney disease, and then some miscellaneous information. I do want to remind you to please like and subscribe. Please support my channel. It is free. And at the bottom, I want to also remind you to please leave comments. Because someone left a comment and asked for a sleep apnea video, I did a sleep apnea video. So I do try to read the comments, and I will try to give you topics that are pertinent to what you need. And I encourage you to share the content with friends and family. So that would be very helpful for other people. So for the relatively new medications that we're talking about today, generally speaking, they do have better outcomes than older medications. And then they help us lose weight, they protect our kidneys, they protect our heart, and they lower our blood sugar. So this is the slide that's talking about the recommendations that I feel you should have some familiarity with. So if a patient has coronary artery disease, which is our way of saying heart disease, then we would recommend the GLP-1 agonist medications and or the SGLT2 inhibitor medications. You can put them together, that's appropriate, or you could do one class or another class. The GLPs are medications such as liraglutide or semaglutide. Many people are familiar with semaglutide. These are the Ozempic-like medications. And then the SGLT2 inhibitors, such as empagliflozin, which is the generic name for Jardiance, those would be considered as well. So if the patient has heart disease, we would recommend the new medications, the GLPs or the SGLTs, and you would consider the liraglutide or the semaglutide, and you might even add or consider instead the empagliflozin. Okay, if you want to learn more about heart disease, please go back to one of my prior videos, go to my channel and scroll through. I encourage you to use my channel as a podcast. That's what I am more comfortable with. So that if you're driving in your car or you're taking a bath or you're doing some chores at home, you could listen to the videos and you could gain some factual information that way. And you could repeat the videos again and again, because a lot of time the information is quite technical. And it's hard to take all that new information in. The second chronic medical condition that we recommend these newer medications for is chronic kidney disease. And for that condition, we would choose the SGLT2 inhibitors primarily. And we would choose either the canagliflozin, which is the Invokana, or the dapagliflozin. And the dapagliflozin is the Farxiga medication. And then you can add the GLPs if you would like the liraglutide, the semaglutide, or the dulaglutide. That's perfectly appropriate as well. The third chronic medical condition that is it's helpful to take some of these newer medications is heart failure. I do have a video on heart failure. I do encourage you to go listen to that again. But if you have already listened to it, remember heart failure, think of it like chronic heart weakness. And for heart failure, you would consider using the SGLT2s as well, either the canagliflozin, the dapagliflozin, or the empagliflozin. Now, the scientific trials have shown that the dapagliflozin and the empagliflozin are helpful with a certain type of heart failure called HFpEF, or heart failure preserved ejection fraction. So there are different types of heart failure. And so it's important that you know your type, or if you have multiple types, and that you are familiar with the various medication classes that are helpful for heart failure. But then there might be medications within that class that are more helpful for your type of heart failure. And then in summary, there are certain medications that seem to be better than another. And this is according to scientific trials or studies. So for heart disease, it does seem like the GLPs are better than the SGLTs. For kidney disease, it does seem that the SGLT2s and the semaglutide are better than the GLPs, the remaining GLPs. And then for heart failure, it does seem that the SGLT2 inhibitors are better. So I told you when I was starting this video that there is one best drug, and that would be the tirzepatide. So in the scientific trials, it does show that it's helpful for many different areas or many different chronic conditions. So you could make a case that this is the best drug of the new medications. The brand name is Mounjaro, and please keep in mind in different parts of the country and the world that this medication is pronounced differently. But I do encourage you to learn the generic names primarily. That's the most helpful, and there would be the least confusion if you do that. Okay, so for this medication, the tirzepatide, remember that there are two ingredients in the medication. There is a class, GLP-1, which we've talked about many times before in a prior video, and now we're talking about it now. But then there's another class of medication, the GIPs. And that one, it's helpful. I have some patients on that medication. You might be on that medication as well. But in this particular slide, what I'm showing you is that this class is combined with the GLP class. And so it is the best medication for type 2 diabetes mellitus. In the past, metformin was the first line medication that we would give. It's the first medication that we would give if someone was diagnosed with type 2 diabetes mellitus. But now these newer medications have taken over as the first line, and you could make a case that Mounjaro could be the first medication that you take. And so if that's the case, the dose that you would start with would be the lowest, which is 2.5 milligram. And then you would give it subcutaneous, or you might be giving it to a friend or a family member. So it's a needle that goes into the skin, and you inject the medication in the fat layer, which is beneath the skin. So that's called subcutaneous. Sub means under. Cutaneous is another way to say skin. And then this medication is taken weekly. You do this 4 times, and then the dose may be increased. You always have to do this with a competent provider. Medications can have pros, which I'm listing a lot of pros today, but they can have a long list of cons. And this video is not exhaustive enough to cover the cons. And so again, please read, question, question, question. Okay, there are a series of trials called SURPASS, SURPASS 1, SURPASS 2, etc. And the results are still pending, but we will know more about this medication, the tirzepatide. There is a trial called SUMMIT, and that trial did show that if the patient uses the tirzepatide, then they will have less incidence of heart failure exacerbation. And remember, heart failure has symptoms like fatigue, leg swelling. So there are times when patients have a worsening, a sudden acute worsening of their heart failure, and that might necessitate a visit or a call to their primary care provider or doctor for an adjustment on their medication or a new medication, close observation, or it might even necessitate a hospital admission. So this medication actually can reduce hospital admissions, so less hospital stays, which is a goal, hopefully, for any patient. There are many downsides to having to be in the hospital. Of course, the upside is that your life is saved. We generally admit patients or see them in the emergency room if they have a life-threatening condition, and then we admit the patient if they have an urgent or life-threatening condition. The safety of this medication is similar to the GLP-1s. So although it's a combination medication, it does have a similar safety profile. Okay, so summary of the new drugs. This is going to be a different way to look at these medications. The canagliflozin, you can look at trials called Canvas and Credence. So please take a screenshot, type this into your favorite search engine, and you can ask your favorite AI, what were the results of the Canvas trial? What were the results of the Credence trial? Was this trial a good trial? And so this particular medication, the canagliflozin, was shown to be good for heart disease and good for heart failure and kidney disease. So 3 different chronic conditions, this medication is helpful. Okay, and then the second medication, the dapagliflozin, you can look at trials called DECLARE TIMI, the DAPA-HF, and the DAPA-CKD. And then these trials show that this particular medication is good to reduce the incidence of death. It's good to reduce heart failure exacerbations and associated hospital stays. And it's good to reduce the damage and complications of chronic kidney disease. So both of these medications are good for 3 major areas. Look at this third medication, the empagliflozin, or the Jardiance. For that, you can look at the EMPA-REG outcome study or the Emperor Reduced trial. And it showed positive outcomes in 4 different areas: chronic kidney disease, heart failure, reducing the incidence of death, and reducing complications of heart disease. So this was a very powerful result. And then I just wanted to show you that there are other medications and classes of medications that scientists study and study and study. And then some medications don't necessarily pan out as having as good outcomes as others. So you might not even hear about these medications, but at least these trials are here and you can read about those if you'd like and see why they failed or why they're not as helpful if you want to. Okay, so this slide is just talking about three particular SGLT2 inhibitors. The first one, empagliflozin, it reduces the risk of major adverse cardiovascular events. Primarily, that would be myocardial infarction or other conditions similar. The canagliflozin, it reduced risk generally, but it didn't specifically say that it reduced myocardial infarctions or major adverse cardiovascular events. And then the third medication, the dapagliflozin, it did not reduce major cardiovascular events. Okay, so the GLP-1 agonists, I've talked about those in another video. We've talked about those so far in this video. Obviously, many studies have been done. It's a safe medication under a competent provider supervision, but then we're learning other things. So for example, we're wondering if pulmonary aspiration is caused by this medication or is it not caused by this medication? Whether or not it is unknown for sure, but we do now recommend that every doctor that you see should be aware of the medications that you're taking. And then if you're going to have a surgery, please do tell your surgeon because you want to prevent pulmonary aspiration when you have general anesthesia. Suicide question mark. The FDA says there's no increased risk, but really more studies need to be done. Semaglutide, but not liraglutide, we just don't know. So if you're on antidepressants or you have major depression and you're being treated, you do, again, want to tell your psychiatrist or your primary care provider, all the physicians and providers that you see, read, and ask questions, ask questions, ask questions. Trust yourself. More scientific trials. So this video is really to go do a deep dive into medications and then how do we reach the conclusions that we reach. It's not an exhaustive list by any means. As you can see, I only put heart events, death. I didn't include a column for chronic kidney disease or another column for heart failure. I was just trying to give you an idea of how we make lists and how we compare and contrast medications. So semaglutide, the SUSTAIN-6 trial, the SELECT trial, and the FLOW trial showed that it was helpful to reduce heart events and the incidence of death. So semaglutide is strong medication with these two particular outcomes that were studied. The exenatide, which you don't hear too much about, it's another medication that was studied, and the EXCEL trial showed that it was basically neutral. It wasn't harmful, but it wasn't too helpful. The liraglutide in the LEADER trial, we did talk about that in a prior video, it did show good outcomes for both heart events and death. And then the dulaglutide in the REWIND trial did show some good outcomes to reduce heart events, but it was kind of neutral in terms of reducing the incidence of death. Okay, let's go back to GLP-1 medicines and how they relate to a different chronic medical condition. And this time we're going to talk about chronic kidney disease. And I set up the slide in a different way, just to kind of get you to look at it differently. But it's really still wondering, is this medication helpful for this particular chronic medical condition, or is it harmful, or is it neutral? What are the outcomes? So in the LEADER trial, which we talked about in the previous slide, the GLP-1 medications did show a lower incidence of nephropathy, which nephropathy is an umbrella term which does include chronic kidney disease, but it includes chronic kidney problems and acute problems. The number needed to treat. So you need to treat 67 patients to get one good outcome over a span of 4 years. This doesn't mean that if you get the medication, there's only a 1 in 67 chance it's going to work. This is just how we set up the trials to do an objective way to measure. And it does prevent new onset macroalbuminuria, which basically means that this medication, GLP-1, does help prevent kidney damage. Okay, and then another trial called SUSTAIN-6, it showed that the GLP-1 medicines lower incidence of nephropathy, similar to the LEADER trial, And then you have to treat 44 patients to get one good outcome over a span of 2 years. The FLOW trial, it included over 3,000 patients. It showed reduced risk of death from chronic kidney disease and adverse cardiovascular events like myocardial infarction or heart attack by 24%. It's FDA approved for chronic kidney disease patients who also have diabetes mellitus type 2. And the REWIND trial also shows a lower incidence of nephropathy. You need to treat 31 patients to get one good outcome over a span of 5 years. It reduces macroalbuminuria, which is powerful, reducing kidney damage, and it does show results that are similar to the AWARD 7 trial. Okay, so this is near the end of the medical information. I want to transition from the medical information to the spiritual information. Up at the top, that's just my watermark for my first book, You're Saved. I encourage you to buy these books. You can go to Amazon, type in Laura Tigler and the name of the books, which are right here. My name is right here. I do have an author website. I encourage you to go look at that. But the first book is called You're Saved, and the subtitle is called A Spiritual Perspective from a Doctor and Military Spouse. Yes, I am a doctor and I am a military spouse. The book is nonfiction. I believe that the book is very excellently written, and I hope you'll enjoy it. It's all about salvation, and as I mentioned in prior videos, I believe almost every human being on the planet needs to be concerned about their salvation and needs to gain their salvation, which I also believe is hard won. Not because you have to work at it, but because you have to have faith. And then the second book that I wrote is called An Impossible Situation. The subtitle is Oppenheimer in Time. I promise you I did start writing it before the big movie came out. So this book is fiction. It's appropriate to read before bedtime or on vacation. I wouldn't say it's a light read, but it's definitely a mystery thriller and engaging for adults. It's more like an escape, more like a bedtime story. And it does have adult content, so I don't recommend giving it to kids to read. It mixes Christianity and Hinduism. I wouldn't say in a playful way, I would say intertwined to make a cohesive spiritual story in the context of a mystery thriller. I am working on a third book, and so I do ask you to consider buying these books, reading them, sharing them, and please do like and subscribe. So we've reached the end of our time together. I just want to say thank you for joining me, and I will see you next time. There we go.